Dr. William Mercer.
Have you ever wondered if your body might try to warn you before a stroke happens? Most people imagine a stroke as something that strikes without warning. 1 minute, everything feels normal. The next, life changes forever. But that isn't always what happens. For thousands of people, the body quietly sends one last message. The problem is that the warning may last only a few minutes. It may disappear completely. And because it goes away, many people convince themselves it couldn't have been serious. I must have been tired. My arm just fell asleep. I guess my blood sugar was low. It probably wasn't anything. By the following day, or within the next 2 or 3 days, a major stroke arrives. As a physician, I've had many conversations with patients and families who wished they had recognized those earlier signs. They often remember the exact moment afterward. There was something strange yesterday. I couldn't get my words out. My vision went blurry for a few minutes. My wife noticed my smile looked uneven. We almost went to the emergency room, but then everything came back to normal. That temporary improvement gave them false reassurance. And that's exactly what makes these warning episodes so dangerous. Doctors call them a transient ischemic attack, often shortened to TIA. You may also hear it called a mini stroke, but that name can be misleading. There is nothing mini about what it represents. A TIA is often the brain's final alarm bell. It means that blood flow to part of the brain was interrupted, but only briefly. The blockage cleared before permanent damage occurred. Think of it like a flickering light in your home. If the lights suddenly dim for a few seconds, you probably don't celebrate because they came back on. You wonder what's happening with the electrical system. Your brain works much the same way. When blood flow briefly stops, brain cells immediately begin struggling to function. They cannot store much oxygen. They rely on a constant supply carried by the bloodstream every second of every day. Even a short interruption can produce dramatic symptoms. Then, if circulation improves, those symptoms disappear. But the problem that caused the interruption may still be there. Perhaps a small clot temporarily blocked an artery. Perhaps plaque inside a blood vessel has become unstable. Perhaps an irregular heartbeat allowed a clot to form and briefly travel to the brain. Whatever the cause, the danger hasn't necessarily passed simply because you feel normal again. In fact, some of the highest risk period may be just beginning. Research and neurological stroke protocols have consistently shown that the hours immediately after a TIA are among the most dangerous. A significant number of major strokes occur within the next 48 to 72 hours. That short window can make all the difference. If treated quickly, doctors may be able to identify the cause, begin medications that reduce clotting when appropriate, control blood pressure, manage heart rhythm problems, or perform other treatments that dramatically reduce the chance of a devastating stroke. But none of that can happen if someone dismisses the warning. That's why today's conversation could be one of the most important videos you ever watch. For yourself, your spouse, your parents, your neighbors, or a close friend. Because these 5 warning signs don't always look dramatic. Sometimes they're surprisingly subtle. Sometimes they appear while pouring morning coffee. Sometimes during a quiet conversation. Sometimes while reading the newspaper. Sometimes while driving home from the grocery store. And because they disappear so quickly, people often feel embarrassed to even mention them. I don't want to bother anyone. I feel fine now. It would probably be a waste of time. Those thoughts are understandable. But when it comes to a possible TIA, they can be dangerous. I want you to imagine someone we'll call Margaret. Margaret is 72 years old. She enjoys gardening every morning before the weather becomes too warm. She still drives herself to church. She babysits her grandchildren on weekends. Her medications are organized neatly in a small container on the kitchen counter. One Tuesday morning, while watering her flowers, something odd happens. The watering can suddenly feel unusually heavy in her right hand, not painful, not completely numb, just different. Her fingers don't seem to obey quite the way they normally do. She pauses. After about 3 minutes, everything returns to normal. She laughs it off. I must have pinched a nerve. The next afternoon, she develops a severe stroke that permanently weakens her entire right side. Looking back, that strange feeling in her hand wasn't random at all. It was likely the warning. Not every story ends that way. Many people who seek emergency medical attention after a suspected TIA receive prompt evaluation, appropriate treatment, and greatly reduce their risk of a larger stroke. The difference is often recognizing the warning before it's too late. Today, we're going to walk through 5 of the most important warning signs that can appear the day before, or even just hours before, a major stroke. Some last only a minute, some last 15 minutes, some come and go so quickly that family members barely notice. We'll also talk about why these symptoms happen, what makes them medical emergencies even if they disappear, and exactly why calling emergency services immediately can be so important. Because when it comes to the brain, time isn't just important. Time is brain tissue. Every minute without proper blood flow places millions of brain cells under stress. The sooner treatment begins, the more brain function may be preserved. So let's begin with perhaps the most commonly ignored warning sign of all. It often starts with something so ordinary that people mistake it for fatigue, or aging, or sleeping in an awkward position. But it can be the brain's first desperate attempt to ask for help. Sign number 1, sudden weakness or numbness on one side of the body. Notice one word there. Sudden, not stiffness that gradually developed over several weeks, not arthritis that aches every morning, not soreness after carrying groceries. We're talking about a change that appears almost out of nowhere. You might suddenly notice that one arm feels unusually heavy. One leg refuses to cooperate. One side of your face feels different when you smile. Perhaps you're buttoning your shirt and one hand simply won't move normally, or you're holding your coffee mug and nearly drop it. This happens because different parts of the brain control movement and sensation on opposite sides of the body. If blood flow is briefly interrupted in one of those areas, the signals traveling from the brain to the muscles become disrupted. Imagine trying to make a phone call during a storm. Sometimes the connection cuts in and out. The message never arrives clearly. Your muscles haven't suddenly become weak by themselves. The communication system controlling them has temporarily failed. That distinction matters. Many people expect weakness to be dramatic, complete paralysis, falling to the floor. But early warning symptoms can be much more subtle. Perhaps your handwriting suddenly changes. Your fork feels awkward in your hand. You notice yourself dragging one foot for a few steps before everything improves. Some people describe it as feeling disconnected from one side of their own body. Others simply say, something wasn't right. Trust that feeling, especially if it appears suddenly. Family members are often the first to notice. A spouse may see one side of the face drooping slightly. A friend may notice an uneven smile in the middle of a conversation. Someone may ask, "Are you okay? Your face looks different." Those observations should never be ignored. One of the most useful ways to remember this warning is through the familiar FAST acronym. F stands for face. Ask the person to smile. Is one side drooping? A stands for arms. Ask them to raise both arms. Does one drift downward? S stands for speech. We'll discuss that in a moment. T stands for time, because every minute matters. Even if the weakness disappears before the ambulance arrives, emergency evaluation is still essential. That temporary recovery does not erase the risk. In many cases, it actually strengthens the suspicion that a TIA has occurred. The brain has already demonstrated that its blood supply is unstable, and unstable blood flow deserves immediate attention. Many people later say something heartbreaking. If I had only known that 5 minutes of weakness could mean something so serious. Now you do, and perhaps that knowledge will help protect someone you love. In the next section, we'll discuss another warning sign that is often mistaken for simple confusion or tiredness, but in reality, may be one of the clearest signals that the brain is struggling. It doesn't affect the arms first. It affects something even more personal, your ability to speak. Sign number 2. Sudden trouble speaking or understanding words. Imagine you're sitting at the breakfast table with your husband or wife. You've had your morning coffee. The television is on in the background. Everything feels completely ordinary. You reach for the salt and try to say, "Could you pass me the butter?" But the words don't come out the way you expect. Instead, they sound slurred. Or perhaps you know exactly what you want to say, but your mouth won't cooperate. Even more unsettling, you may open your mouth and completely lose the word you were about to use. You know it's there. You can almost reach it. But it's gone. For a few moments, language itself seems to slip away. Then, just as suddenly, everything returns to normal. Many people laugh it off. "I guess my brain wasn't awake yet. I'm just getting older. I've been under a lot of stress." Occasionally, everyone struggles to find a word. That's a normal part of life. But a sudden inability to speak clearly or difficulty understanding what others are saying is very different. It deserves immediate medical attention. Why does this happen? Your brain contains specialized areas responsible for language. One region helps you form words. Another helps you understand them. These areas rely on a constant supply of oxygen-rich blood. If blood flow is interrupted, even briefly, those language centers can stop working properly. Think of it like a radio station losing power. The equipment is still there. The message simply can't be transmitted clearly. Sometimes speech becomes slow and slurred. Sometimes words come out in the wrong order. Sometimes a person says something that makes no sense at all. Other times, the individual understands every thought in their own mind, but cannot express it. That can be frightening. Families often describe the moment vividly. "Dad looked at me like he wanted to answer, but he couldn't get the words out." Mom kept repeating the same sentence. "My husband was speaking clearly, but none of it made sense." Because these episodes can disappear within minutes, people often postpone seeking help. That delay can cost precious time. If someone suddenly develops slurred speech, difficulty speaking, or trouble understanding language, even if it completely resolves, it should be treated as a medical emergency. Do not wait until tomorrow to call your doctor. Do not decide to see how you feel after dinner. Call emergency services immediately. The healthcare team can begin evaluating whether a TIA or stroke is responsible and determine the safest next steps. Now let's move to a warning sign that surprises many people because it doesn't involve movement or speech at all. Instead, it affects one of the senses we depend on every waking moment, our vision. Sign number 3, sudden changes in vision. Vision problems caused by a TIA are often painless. There is no burning, no itching, no redness. That's one reason they're so easy to dismiss. A person may suddenly notice that vision in one eye becomes blurry. Others describe a dark curtain briefly passing across their sight. Some experience double vision. Others lose part of their visual field without realizing it immediately. Imagine reading the morning newspaper. The words on the left side of the page suddenly seem to disappear. Or you're driving and fail to notice a vehicle approaching from one side. You may think your glasses need cleaning. You rub your eyes. You blink several times. But the problem isn't in your eyes. It's in the blood supply serving the brain, or sometimes the blood vessel supplying the eye itself. The retina and the brain are remarkably sensitive to reduced circulation. Even a brief interruption can dramatically affect what you see. One patient once described it this way. It was as if someone lowered a window shade over one eye. That image has stayed with me for years because it's exactly how many people explain the experience. Then, a few minutes later, the shade lifts, vision returns. The temptation is enormous to forget about it. Please don't. Sudden vision loss, especially in one eye, can be a critical warning that a blood vessel is narrowing or that a small clot has temporarily interrupted circulation. An eye examination alone may not reveal the underlying cause. That's why emergency evaluation is so important. The goal isn't simply to restore vision. It's to prevent the next event from causing permanent injury to the brain. This is also a reminder that stroke symptoms don't always affect the entire body. Sometimes only one function is involved, only vision, only speech, only one hand. Even isolated symptoms can signal a serious problem. Now, let's talk about a warning sign that people often mistake for being clumsy or simply having a bad day. But when it appears suddenly, it may tell us something very different. Sign number 4, sudden dizziness, loss of balance, or difficulty walking. Growing older naturally brings changes in balance. Muscles weaken, vision changes. Arthritis affects our joints. Those changes usually develop gradually over months or years. A TIA is different. The change happens abruptly. You stand up and suddenly feel as though the room has shifted. You begin walking down the hallway and drift unexpectedly toward one side. You reach for the kitchen counter because your balance suddenly disappears. Some people describe feeling as if they're walking on the deck of a moving boat. Others say they simply couldn't coordinate their legs, not because they were tired, because their brain wasn't processing movement correctly. The back part of the brain, the cerebellum and nearby structures, helps coordinate balance, posture, and smooth movement. If blood flow to these areas is interrupted, even briefly, standing and walking can become surprisingly difficult. One important point is that dizziness alone can have many causes. Inner ear conditions, dehydration, medication side effects, and low blood pressure can all produce similar sensations. But when dizziness is sudden and accompanied by difficulty walking, poor coordination, double vision, numbness, weakness, or trouble speaking, stroke becomes an important possibility. Those combinations should never be ignored. Imagine an older gentleman walking his dog around the neighborhood. Halfway through the walk, he suddenly veers toward the curb. His wife assumes he tripped. He says he's fine. 5 minutes later, he walks normally again. The next morning, he suffers a major stroke. Looking back, that brief loss of coordination was not simple clumsiness. It was the brain asking for help. Many strokes affecting the back of the brain are unfortunately recognized later because the symptoms seem less dramatic than facial drooping or arm weakness. That's why awareness matters. If your balance suddenly changes without explanation, particularly when combined with any other neurological symptom, don't try to drive yourself. Call emergency services immediately. Rapid assessment can identify whether the cause is a TIA, a stroke, or another condition requiring urgent treatment. Finally, let's discuss the 5th warning sign. This one can be especially confusing because people often blame fatigue, stress, or even a migraine. Yet in some individuals, it may represent the final warning before a larger stroke. Sign number 5. A sudden, unusual headache, especially when accompanied by other neurological symptoms. Not every stroke causes a headache. In fact, many do not. But when a severe headache appears suddenly and feels very different from your usual headaches, it deserves careful attention. People often say things like, "I've never felt a headache quite like that. It came on all at once. It wasn't my normal migraine." Sometimes the headache is accompanied by nausea, sometimes by blurred vision, sometimes by weakness, numbness, confusion, or difficulty speaking. Those combinations are especially concerning. Your brain itself does not feel pain the way your skin does, but the blood vessels and surrounding structures can trigger pain signals when something is wrong. While there are many possible causes of a sudden severe headache, including migraines and other non-stroke conditions, it is never wise to assume, particularly if the headache is unlike anything you've experienced before. Older adults who suddenly develop a severe headache with neurological symptoms should seek emergency medical evaluation immediately. Healthcare professionals can determine whether the cause is a stroke, bleeding in the brain, or another serious condition requiring urgent treatment. The key message is simple. Don't diagnose yourself. Don't rely on internet searches. Don't wait for the symptoms to settle down. Let trained medical professionals make that determination as quickly as possible. By now, you may have noticed something these 5 warning signs have in common: weakness, speech changes, vision loss, balance problems, sudden unusual headaches with neurological symptoms. Each one may last only a short time. Each one may disappear completely. And that temporary recovery is exactly what causes so many people to delay getting help. But when symptoms come and go, the danger has not necessarily passed. Sometimes the body has simply given you a brief opportunity to act before something much more serious occurs. That opportunity may last hours, sometimes only minutes, sometimes up to a couple of days. No one can predict exactly which TIA will be followed by a larger stroke. That's why every suspected TIA deserves immediate evaluation. The safest response is never to assume it's nothing. It's to assume your brain is worth protecting. Now that we've talked about the 5 warning signs, let's discuss what you should actually do if you ever experience one of them, or if you notice them in someone you love. This is where preparation can save precious minutes. When symptoms begin, many people try to explain them away. I'll lie down for a while. Maybe I just need something to eat. I'll wait until morning and call my doctor. Unfortunately, the brain doesn't always give us that luxury. The safest response is simple. Call your local emergency services immediately. Do not drive yourself if you are having stroke symptoms. A stroke can worsen without warning, affecting your ability to drive safely. Emergency medical teams can begin assessment on the way to the hospital and alert the stroke team so treatment can begin as quickly as possible. Just as important, don't let someone talk you out of seeking help because they feel fine now. A TIA is defined by symptoms that improve, but improvement does not mean the underlying problem has been solved. Think of a TIA as a smoke alarm. When the alarm stops ringing, you don't assume there was never a fire risk. You look for the source before something much worse happens. The same principle applies to your brain. What happens at the hospital? Many people hesitate because they worry they'll be embarrassed if the symptoms have already disappeared. Please don't let that fear keep you at home. Doctors and emergency teams are trained to evaluate people whose symptoms have resolved. Depending on your situation, they may perform brain imaging to look for signs of stroke or other conditions, blood vessel imaging to check for narrowed or blocked arteries, heart rhythm monitoring, since conditions such as atrial fibrillation can allow blood clots to form, blood tests and other evaluations to identify risk factors, a review of your medications and medical history. The goal is not simply to explain what happened. The goal is to prevent what could happen next. Sometimes treatment may include medications that reduce the risk of clot formation, better blood pressure management, cholesterol-lowering therapy, treatment of abnormal heart rhythms, or procedures to improve blood flow when appropriate. The right treatment depends on the cause, which is why a prompt medical evaluation is so important. Who is at higher risk? Although anyone can have a stroke or TIA, certain conditions increase the likelihood. These include high blood pressure, diabetes, high cholesterol, smoking, atrial fibrillation or other heart rhythm disorders, previous TIA or stroke, heart disease, obesity, physical inactivity, sleep apnea, advancing age, a strong family history of stroke. Having one or more of these risk factors does not mean a stroke is inevitable. It means paying close attention to warning signs becomes even more important. The quiet habits that protect your brain. While no lifestyle habit can guarantee that a stroke will never occur, years of research have shown that healthy daily choices can significantly reduce risk. One of the most important is controlling blood pressure. High blood pressure often causes no symptoms, which is why it has earned the nickname the silent killer. Yet it remains one of the strongest risk factors for stroke. Checking your blood pressure regularly and working with your healthcare professional if it's elevated is one of the most effective ways to protect your brain. Blood sugar matters too. Poorly controlled diabetes can damage blood vessels throughout the body, including those supplying the brain. Managing blood sugar through a balanced diet, regular physical activity, prescribed medications when needed, and routine medical follow-up can make a meaningful difference. Don't overlook cholesterol. Too much LDL cholesterol can contribute to plaque buildup inside arteries, making them narrower and increasing the risk of a clot-blocking blood flow. Your healthcare professional can help determine whether lifestyle changes, medication, or both are appropriate for you. Movement is another powerful tool. You don't need to run marathons. A consistent daily walk, gentle strength exercises, or activities approved by your healthcare provider can improve circulation, support heart health, and help maintain balance and mobility. If you smoke, seeking help to quit may be one of the most important decisions you ever make for your brain and your heart. And if you've been diagnosed with atrial fibrillation, take that diagnosis seriously. This irregular heart rhythm can allow blood to pool inside the heart, increasing the chance of clot formation. When those clots travel to the brain, they can cause a stroke. For many people, appropriate treatment dramatically lowers that risk. A conversation every family should have. One lesson I've learned over the years is that strokes rarely affect just one person. They affect entire families. Children become caregivers. Spouses suddenly face enormous responsibilities. Grandchildren watch loved ones struggle with activities that once seemed effortless. That's why awareness shouldn't stop with you. Share what you've learned today. Talk about the warning signs over dinner. Mention them to your spouse, tell your neighbors, call your parents. The more people who recognize a TIA, the more opportunities there are to prevent a devastating stroke. Sometimes one conversation changes the outcome of an entire family's future. Remember the 5 signs. Before we finish, let's review them one more time. First, sudden weakness or numbness on one side of the body. Second, sudden difficulty speaking or understanding words. Third, sudden changes in vision, especially in one eye. Fourth, sudden dizziness, loss of balance, or difficulty walking. And fifth, a sudden unusual headache, particularly when it occurs along with other neurological symptoms. If any of these symptoms appear suddenly, even if they last only a few minutes and then disappear, treat them as a medical emergency. Don't wait. Don't guess. Don't hope they'll stay away. Seek emergency medical care immediately. Those few minutes may be your brain's final opportunity to warn you before a much larger stroke occurs. A final reflection. As we grow older, it's easy to assume that every new ache, every forgotten word, or every unusual sensation is simply part of aging. Sometimes that's true, but sometimes your body is asking you to pay attention. Your brain is remarkably resilient, but it is also incredibly dependent on a steady supply of blood and oxygen. When that supply is interrupted, even briefly, it deserves immediate attention. The encouraging news is that many strokes can be prevented or their impact greatly reduced when warning signs are recognized quickly and appropriate medical care begins without delay. Knowledge doesn't eliminate risk, but it gives you the power to act before it's too late. If today's discussion helped you better understand the warning signs of a TIA and stroke, I hope you'll share it with someone you care about. One conversation, one shared video, or one moment of recognition could help someone seek treatment in time. I'd also love to hear from you. How old are you, and have you, or someone close to you, ever experienced a TIA or stroke warning that turned out to be more serious than expected? Your experience may encourage someone else to recognize the signs sooner. Until next time, take good care of yourself, keep asking questions, and never ignore a sudden change that your body can't explain. Stay sharp. Be happy.